Charlie, bienvenido. Thank you for joining us. Right now, I'm waiting for my special guest today, mi queridísimo Tavis Banks, que debe estar llegando en cualquier momento. Charlie, how's your day going and everything? Okay. Going to goof a little bit right now. In the meantime, that we're having everything in there, I'm going to go and try to give headaches to Tavis. Give me 1 second. Don't run away. I'm back. Yeah, no, it has been an interesting day, and I don't know if everything has happened with you, Charlie, but right now with the changes of COVID and the way that we're managing everything, it has been changing so fast. And it has been, yes, exactly. We're actually trying to get him involved with. He has been doing a lot of good stuff, and he has been in charge of education and creating modules for the community. Then it has been very, very, very important part of the efforts that he has, and he has a couple ideas on management, because as you know, we have been changing it a lot, and the way that we have been changing it has been on hard, because one thing is having your entire team in a bubble, and the other thing is actually having everything around you. Karen, bienvenida. Welcome. I'm actually waiting for my special guest. I'm going to start hugging him and stuff right now. But yeah, we're talking with Charlie, Karen, that one of the things that we're having is trying to figure out how can we better manage our teams in times of COVID, especially that the space constraint, it's not that real anymore. And it's actually changing, and it's growing, and we have a lot of other stuff. Señor, hola, el shuru. Pleasure to coming over here. Let's figure out what's happening. And right now he's coming here. Dun 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 dun. Yeah, then the part of the conversation is having this integrity of what's new, what can we do, especially right now that this will become a new normal, the hybrid workstation. Everybody was deadly afraid if we will survive something like this with efficiency, if this could make a huge difference or not. But right now, we're going to move all together and go and search for Tavis. One of the important things is that, as we know, efficiency is measured by the way that we create and finished with goals, and most importantly, how we can actually create value for our patients and our healthcare system. Then one of the things that we have is the most important part is making sure that we're happy and healthy. And I have here, and we're going to procreate social distancing. I have here my special guest, Mr. Tavis. We'll be doing this in two cameras. That way we have social distancing. Yes, it's weird, I know, but we'll be doing that way. And we will starting in 2, 3, 5.
Yeah, I'm getting in right now.
Excellent.
I have joined the party.
And he is joining right now, and I'm just waiting here to get it update. Charlie, thank you for waiting with us, and 100%. Oh no! My best coach ever, that she brought me that stuff, and right now we have everything. Thank you, Francesca. And yeah, we're good. Then we're going to do something weird, that it's going to be social distancing and Instagramming on the same room. Then at least we have a lot of other stuff going down here. Hey, that's my friend. And I'm going to we'll have this over here. Now we have this. Okay, Mr. Tavis.
Yes,
One of
sir.
the most important things that we have right now is the way that we take care of each other. And tell us, what do you think that the what's going to be the biggest changes that we're going to be having after the coronavirus?
Well, some of the biggest changes are that we've learned that we can quickly shift and, to move from a full workforce coming into the office every day to being at home is just an awesome thing. And we know that it works.
Let's turn on or off the volume, and that way we are still here and
There
being
we
each
go.
other. Excellent.
So, yeah, definitely um, improving the way that we communicate with each other. We've been able to do that within the last few weeks.
It's working.
And definitely it's working.
That's awesome, and like right now, one of the things that I was starting the conversation with it was that a lot of the people that we have around us were deadly afraid of doing the switch. We thought that being in a physical space was the most important thing that we have as leaders, as healthcare providers in any step of the way. Then what do you think about that?
Um, you know, I did a post on LinkedIn earlier this week called Shift Happens, right? So we know that we have to be able to be agile and flexible and move into different spaces. And before was more of, no, we can't do that, but we were forced to. So what that taught us was we're able to, work from home. We're able to social distance. And the most important thing about that is staying connected.
Mm-hmm.
We have to stay connected. Even though we're not physically connected, we have to stay connected. And there's some ways to do that.
Do you have any routine or a schedule or anything that you want to share with us? That way we can continue doing that.
Definitely. And I would love to give props to my wife because she's at home working full time and being a full-time teacher now as well to my 7-year-old. So one of the important tips that she did was she was able to flex and get up earlier, get some work done, get a couple of hours of work in before my son wakes up. And then when he wakes up, she clocks out, she cooks breakfast, gets him all washed up, ready for his day, sets him up on his computer so he can do his schoolwork. And then she clocks back in and gets the rest of her day done. So it's important to make those adjustments. And for myself, you and I are still coming into the office every day. So it seems like it's not different to us. But for me, I'm making sure I'm checking in with my teams. I'm making sure I'm checking with my wife and my son to make sure he's getting his work done as well. So just more frequent check-ins. Just like as when you were in the office, you get to have those hallway conversations. Now you have those on the phone.
I know one of the hardest things that I had at the beginning was like, how much is enough to create this things, and I think that we have and I kudos to my partner in crime here, Jessica Solares, that she has doing an amazing job making sure that we are keeping aligned with the entire team. That right now we're growing and. We switched an entire operation of community health specialists, educators, advocates, public health masters in absolutely everything that you can imagine, civic engagement teams, people that were going to schools, and everything was really based on physical grounds. And we were doing a lot of help with social determinants of health. Then we never thought that we needed to change our entire operation in a matter of weeks on an efficient way to the hybrid mode. Actually, right now, no, it's virtual mode, not even hybrid mode, virtual mode. Right. And let me share one of the things, and it's quite interesting that you're right, that the connection is very important. And one of the things that I'm loving to hear is the wins that we're having. And they are like amazing, little wins of, people that, God, and actually I'm getting chills right now. It's people that were very in need of basic things, food, social services, and thanks to the hybrid mode, it actually created a different way that we could spend more time with them and making sure that they were Good. Is there any recommendations for the teams? You know, as managers, we get it. We need to do these check-ins, but as a team member, is there anything that you suggest to start this type of conversations with the managers?
Oh, definitely. I think, as managers, we're responsible for getting everyone together, but I think team members, you're responsible as well. So don't wait for your manager. Organize those team meetings. Most of us have monthly, at least monthly team meetings, sometimes biweekly, but have those conversations. Get on a Zoom call. Get on a you know, Facebook. Get on Instagram Live. Anything to stay connected and make sure everyone knows how everyone is doing, because it's the worst thing to suffer in silence. We want to make sure we're, connecting with each other, and just even if it's a 2 minute chat, we have to have those.
I like that philosophy, and I think that as a rule right now, too much communication is better than no communication at all.
Absolutely.
And after that, you can self-regulate on what you're actually doing or not. And I think that that's part of the things that we have in front of us. Then, but it's going to be interesting because right now I feel that our teams are getting actually better communication than before, and it's a different communication because we are actually going the old style. We actually are going to our homes. We are sharing other stuff. We see the human part of us that I think that it's elevating the way that we treat each other and that we understand. We're seeing our kids, our grandparents, our partners. Then I think that's going to be. I'm very hopeful that this will change the way that we do, work and how healthcare is moving to more. Even though that by definition healthcare is humane, we're moving more to a humane based part of it.
Yeah, absolutely. Even just small things as family time. Us being forced to be in the side with each other has forced us to have family dinners, family talks, family game night. I mean, it's been awesome. Really, it's a blessing in disguise. And it's the way we do healthcare, it just means more check-ins, making sure we're checking on those who we normally would think, oh, they're okay, they're fine. No, let's call them up and make sure that they're doing okay. So I have, a mother that's getting older, and I have to make sure I call her more often. Make sure, are you taking your medicine? Did you go to your doctor's appointment? She says, no, I'm not going to that place. But no, when they need to, make sure that they're getting there and going with them, and things like that. Even though we have to social distance, we have to make sure they're connected with their healthcare provider. And I think that's just so important.
I completely agree. And you know what? You're reaching at quite an interesting point that um, in the old days, you did your career in a specific way, and you continue on an enterprise or community clinic or anywhere for many years, and that was your life. Right now, I think that we're going back to that place because we became very materialistic on jumping and doing the jumping part of it. But I think that right now, a lot of and I feel really blessed that where we are actually working, they are actually being human, and I think that's going to at least create a better sense of my entire team because we are protecting absolutely everybody. We're making sure that we are, we have an amazing Dr. Cheryl Brown that was taking the leadership of all the infection disease control stuff that we were doing. Then I think that the connection that we're having between us, the community clinics, the efforts that we're doing as a team, I think that it's completely reflecting on how do I picture myself here in the future, and I think that that's us as managers. I think that that's extremely important that we can do and we continue.
Yeah, absolutely. It's our leadership has been awesome, amazing, making sure that we have what we need to do our jobs. And we've learned that we can really flex and do different duties and different things at work, and it's going well. So I'm very proud of the organization and the way they're able to be flexible and move. And I'm just glad to be here.
And I have a question for you, Tavis. What do you think that it's the a very common error that managers we do, especially right now that we're changing everything to a virtual world. What's the most common error that we need to just run away from?
I think the most common thing that we do is we think that everyone knows everything. Oh, they're fine. They know what to do. And you don't bother to ask. And a lot of times our employees, they don't ask either because they don't want you to know that they don't know. So just being overly conscious of, let me go back to the basics. Let me make sure that everyone's on the same page. Let me make sure that everyone has access to the tools that they need and that everyone knows how to get what they need when they don't have it. And that's the most important thing, is to make sure we're understanding that our staff are people and they need things, and we have to be there to remove barriers and obstacles and take care of them.
I completely agree, and part of that obstacles, at least on my side, was at the beginning where I think that the communications in the world, in the government, not even here in a company, but in the world, were very paternalistic. It's like, don't worry, everything will be fine. And after that, it was like, okay, you're telling me that it's like a flu, but it's killing thousands of people. Then where is the truth and the communication part of it?
Right.
And I think that the take-home message that I take on this part is that we need to be realistic. We need to readjust the information that we have, and we need to do this rapidly. And when we have an error on the data or the way that we communicated something, we need to make sure that we address that and making sure that this was an error. We have new information. This is the new course that we're taking, and I think that's better than creating expectations that they don't exist. One of the conversations that I was having with other leaders on in healthcare were, like, when are we going to go back to normal? Right. And the answer is, we don't know.
We don't.
Yeah.
I don't think we will go back to normal. The buzzword has been the new norm, right? What is the new norm? And those things are going to be defined. We have to define those. So what works, what didn't work, what worked well, and just being flexible. And we know that we can now, right? So I think raising some expectations and lowering some in other places is what's going to be important. So some of our staff is at home, and we know they have kids. We can't expect them to do everything that they did before and still be a full-time teacher to their children. But when we look at the numbers, a lot of them are being more productive. Why is that? Because they're comfortable. They don't have to worry about traffic and stress and all of that of commuting. They're right there to make sure their children are okay. They can see them, and they don't have to worry about what's going on. So reducing some of that stress has come out of a stressful situation.
I'm just laughing inside of me because there was a post recently that I saw that it's like a paper. It says, like, the answer is no. The second answer is, like, snacks are on the drawer. No, you cannot have candy again. And there's a lot of things that are out there, and I'm very happy to hear that the way that the families are readjusting, and probably the first weeks were chaotic, and right. Probably there was like a breakdown. At least I feel that there was like a big breakdown, like at week 4 to 5, when we were like, oh my God, this is not going away.
Right. Right. Definitely, we don't know how long, and we keep hearing different things about, okay, in a couple of weeks we'll go back to normal. Maybe this is going to last till August or September. And I think you hit the nail on the head when you said it's all about communication.
Yeah.
Communicate the information we have now. And this is subject to change based on what's happening in the world.
Yeah, no, and I had this morning a great conversation with the team, and like setting up expectation on when can we start doing face-to-face systems or care with patients that have diabetes, that are at higher risk, and the answer is, like, one thing is, one step at a time. We need to know that we are evaluating a lot of our patients. We need to make sure that we are taking care of all the other stuff that we have around us in order to start like thinking if we're going to be bringing, for educational stuff. But one of the side effects that we have right now is that we're conducting diabetes group visits virtually. We have never done that. We're doing diabetes prevention programs. We have never done that part, and we are going to do. We have a weight management program for kids, especially right now that they're at home, and lack of mobility. It's an issue. It's coming, and we're very happy and blessed to do this, and we in a, and we're adjusting, and that's our. I like that buzzword, like the new reality.
Right. And definitely, I saw some videos of kids doing laps around the living room, or through the house, just trying to stay active. I know my little son, I bought him a baseball net, and I said, go out and hit some balls off the tee. I bought him a speed ladder, so he's doing little things in the yard, and we have a very small yard, but we have to make it work. So just making sure that they're staying active. And as far as the diabetes programs, I bet people told you, no, we can't do that virtually. But we found out how quickly, yes, we can. And it's working.
Yeah, and that's part of it. And I have a question for you, and that's something that I want to share with our teams and managers. How are you taking care of yourself? Do you have a special routine? Are you doing anything specific right now in COVID times?
I think the most important change is just being conscious of how much I'm being hygienic, or paying attention to hand hygiene, making sure I wash my hands and don't touch my face. Just being more conscious of those things, and I don't think too much has changed other than that. Maybe a couple more showers, but just making sure that you're looking at everyone in your house, and hey, make sure you wash your hands, make sure you're not touching your face, and just abiding by the CDC guidelines and things like that. Putting on that mask when you go out in public, when you pump gas, put your gloves on. Just little things like that, and I think it's a good thing all around. We're being cleaner.
No, and one of the side effects of this is that this doesn't only take care of coronavirus, but also influenza. Right. And other viruses that we have out there. Then it's a double whammy for a lot of them. And you're right. And a lot of people were asking me, Dr. Shapiro, what's yours? What do you do for diet and all this stuff? And on reality, this is a beautiful secret that I have. It's the Shapiro diet, and I'm going to share it for the first time with you, Tavis. Run away from sodas, snacks, not the bad things. I'm more concerned on the things that you're actually eating than the things that you're not eating.
Yeah, it's a good thing you said that. It reminded me that for this whole 5-week process, I've only eaten out twice. So I'm a notorious go out and get lunch every day kind of guy. And I've only done that twice since this whole thing's happened. So I'm saving on that junk food, and I'm saving money as well.
I just want to correct yourself. This is actually the number of weeks that we have been doing it.
It seems like it's been 1 week this whole time. It seems like it's been yesterday,
I know,
at the same time forever.
Those 5 weeks. And and that's the interesting part that my routine has I'm still waking up like at 5:30 a.m. to make sure that I try to do exercise, try to do yoga, try to do meditations, interviews, and start the day. And that I think that has been the key of this, making sure that us and our teams continue with a routine of checking in and making sure that they replicate the same routines with the team.
And definitely, getting up and walking away, even though you're at home, you may feel more comfortable. Take those mini breaks. Separate your eyes from the screen. That keeps you healthy. Make sure you do take those walks, and stay away from the fridge.
We have a couple more minutes to do the conversation after that. If anybody wants to start sending questions, that's perfectly fine. one of the things that I learned was that how much I miss the interaction with my team. Because sometimes like being in the same space, you get like like candid interaction that you were not expecting,
Right.
and you hear things and you can help things and you can solve things with one conversation instead of like 400 billion things. Then
Right.
that's one of the things that I miss. The other thing is that, and I think that the team is actually doing it perfectly well. Is that if there's two emails, that equals a call.
Right. Right.
Why you want to do like telegraph email thing? Just call.
Yeah, if it's more than 3 lines, give me a call. We can probably take care of it before you could even finish that email.
Completely. Times, anything that you want to add? Anything that you feel that we missed?
No, just making sure that everyone's calm. We're going to be okay. Take care of your loved ones. If you're a parent and you have kids, if you're ever flown anywhere, what does the flight attendant tell you? If we lose cabin pressure and that mask comes down, put your mask on first. Because if you don't put your mask on, you won't be able to help anyone else if something happens to you.
Following your recommendations right now. Following your recommendations. Well, Tavis, it has been a pleasure to have you here. I hope that we repeat this in the following weeks.
Definitely.
And please follow Tavis. He has.
Let me follow your lead. I'm gonna put
I love this one. Then yeah, it's extremely important right now that we all cherish each other, and please follow the conversations that we're having. Tavis has been very, very active on the LinkedIn area, and of course has been a leader on creating best practices in times of need, like coronavirus, and making sure that we're still responsible for our teams and we continue taking care of absolutely everything. Anything we already talked about what's the best practices that we have, creating your schedule, your routine for your teams, making sure that you're checking in, even if it's a little bit, following his recommendations, even if it's a little bit on the more side and more repetitive, it could be better. The other one is take care of yourself, create your routine, and that way you can create a